Hi guys, my name is Bedelia and I'm going to be talking about that special K. So this is just an overview of what we're going to be going over for this presentation. All right, so what is ketamine? Ketamine, which is also known as special K, vitamin K, Kit Kat, or even a horse tranquilizer, is a dissociative anesthetic that has hallucinogenic effects. This drug makes patients feel detached from their pain and environment, which is why they refer to this drug as a dissociative anesthetic. This drug was first introduced in the 1960s, where it was first used as an anesthetic for both humans and animals, which is why people call this a horse tranquilizer, because that's what it was actually used for. And in the dissociative state, patients would look like they're awake, being able to breathe on their own, and the airway reflexes still working, but consciously, they would not know what's happening, nor did they respond to the sensory input. Although ketamine can be a great deal for many patients, and in certain medical situations, it is also to be seen and used at raves or even dance clubs. That reason is because it is a popular drug on the rise because of its hallucinogenic effects that it produces, making sight and sound better while feeling disconnected from your body. Individuals who experience that feeling of disconnection feel like they're having an outer body experience, and they call this a K-hole, K-land, or even God. Ketamine can come in as a clear liquid or a white powder, and they can be packaged in small glass bags, capsules, paper, and even in aluminum folds. Now, the effects of ketamine. So, since ketamine is a dirty drug, which is a pharmacological term, meaning it doesn't just target one system, but many systems in the brain at once, it is known that ketamine affects the glutamate neurotransmitter in the brain, which is the area that oversees the signals being passed from one neuron to another. When glutamate does is it allows the communication between neurons, and without it, your neurons can't do the normal functions your brain would do or communicate with one another. Now, in high doses, ketamine blocks this part of your brain off, sedating you, making you lose consciousness. And in low doses, it enhances the glutamate production, which can make you feel intoxicated or that outer body experience, putting you in a dissociative state. As for the body, after a couple of minutes of using K, your heart rate and blood pressure increases, and of course, over time, it gradually decreases. But while in that state, you just have dilated pupils, salivation, involuntary rapid eye movement, and stiffening in the muscles. Now, for the risk in short term, K can cause loss of motor coordination, disorientation, and even nausea. You can find yourself throwing up and just feeling sick. It also changes sensory perceptions, and that's where those feelings of detachment come and stay. And as for long term, ketamine causes neurological risks that cause memory impairment and even a decline in executive functioning. To add on to this, effects of long term could result in cognitive and emotional changes that lead to the development of ketamine addiction. Furthermore, into ketamine addictions, you can have psychotic episodes that make you say or do impulsive things. And of course, over time, it damages your liver and urinary system just as any other drug would do. You can overdose on ketamine, and it can be fatal when other drugs or even alcohol is involved. Now, prevention and getting help. So, some ways we can prevent addiction or misuse of ketamine is through the education of the risk and the drug itself, and we should only be taking ketamine under medical circumstances. And you should seek support early on if you start to notice cravings or increase in drug use. If you or someone you know is struggling with ketamine misuse or dependence, there is professional help available. Here are a list of resources of health facilities you can contact that will provide the help that you need. American Addiction Centers, you can get a hold of them and they'll have an addictions navigator help you navigate through what options you have or what you can do about this addiction. And treatmentatlas.org is a website where it allows you to find facilities or programs in your location that will help you with addiction as well. Now, in conclusion, we learned what ketamine is, what it does to both the body and the brain, the many risks and consequences you will face if you misuse ketamine, and how you can prevent addiction and get the help that you need. So don't misuse or depend on ketamine unless you are down to suffer with chronic side effects that will affect you forever. Thank you.